I'm Kenya Brown, and welcome to Black Health 365. And today we're going to bring you some great information about prenatal care and centering pregnancy matter for moms to be. And did you know that early and consistent prenatal care is one of the best ways to protect your baby's health and your own? Today we're diving into two important topics for moms to be: the importance of prenatal care and the innovative approach to pregnancy support called centering pregnancy. Joining us is Dr. Ayana Smith, an OBGYN at University Hospitals, and Courtney Steer-Massaro, a certified nurse midwife for the Centering Pregnancy program at University Hospitals, who will discuss why prenatal care matters, what to expect during your pregnancy journey, and how group prenatal care builds strong connections and healthy outcomes for moms. But before we begin, it's important to highlight a pressing issue in our community. In Cuyahoga County, we've experienced a concerning rise in infant mortality, the highest rate in 5 years. This underscores the critical need for accessible and effective prenatal care programs like centering pregnancy. Now let's explore how early and consistent prenatal care can make a significant difference in maternal and infant health outcomes. How are you, ladies?
Great, thank you.
Thank you.
Absolutely. So, why is prenatal care so important for pregnant people?
That's a great question. Thank you, Kenya. And what prenatal care allows us to do is to optimize your health and also optimize the health of your baby through consistent communication with your provider and looking at all of the nitty-gritty elements of health that get us to the finish line in a pregnancy, hoping for the most optimal outcome for you and your baby. So prenatal care looks a little bit like regular doctor's appointments, but a lot more frequent than probably you've ever experienced. And what we do before you get into prenatal care is just make sure that we are understanding who you are, what you're bringing to the table with your health, and then your goals for your fertility. And as we get into the details of a specific pregnancy that you're having, we're looking at your own vitals, your own lab work, the anatomy and health of the baby as your pregnancy progresses, and all the factors around that that you might not think are considered healthcare, like pelvic pain or the food that we're eating, the environment that you're living in, the stress in your life, all the things that contribute to a healthy pregnancy, which is our goal.
Absolutely, because even though childbirth is magical, it doesn't start at birth. So we got to take care of ourselves beforehand and take care of those little ones before they even get here. Now, when should someone even start prenatal care?
That's a great question. And as I mentioned a little bit, ideally, we'd want you to come and establish care with a medical provider even before you become pregnant, when you are first thinking, hey, maybe this is my time to try for pregnancy. Because a lot of the things that we are hoping for in the development of a growing, healthy baby really starts at conception and starts even before then. We want to make sure your iron levels are appropriate, that your weight is as optimal as it can be, you're eating the right amount of foods and lowering your stress, and then also taking the right vitamins that will help support early development of a baby. So we'd love to see you beforehand. But of course, as soon as you find out you're pregnant, we also would love to see you then. And that could be as simple as getting in touch with a doctor or a midwife and saying, what's the good time that I should come? Or at least getting some imaging to confirm your pregnancy if you're not really certain how far along you are, if you have abnormal periods, for example. So, earliest is best, and that allows us to establish our goals with you as early as we can, and also optimize every part of your health, even the things that you're not thinking about yourself, and give you tools to make your pregnancy as smooth as possible.
And I want to touch on the prenatal vitamins because I feel like that is the sticking point for a lot of people. They don't like to take them. But how important is that?
It's very important. And probably for us here in the Cleveland area, people don't think a lot about their own anemia or their iron levels and how their own blood is supporting the oxygenation of their body. But there are also other elements, other vitamins and elements that are important for our development and cell growth. And, we don't get a lot of sun here in Cleveland. So looking at your vitamin D levels, making sure your calcium is good and your bones are healthy. Those are all things for you. But then the part of prenatal vitamins that's really important and different than other vitamins you might take in your life is something called folic acid. And this helps with the development of the neurological system of a baby. And you really don't get a lot of folate in a lot of other places, oftentimes in our regular diet. And so supplementing folic acid to reduce the risk of any abnormal development of the neurological system is really important at the very early stages of pregnancy. So trying to take the prenatals at least at the beginning would really
Please.
help the baby. And the
Yes.
prenatals have good elements for mom as the pregnancy continues as well. So we can try to find prenatals that aren't as nasty as others and talk to you about different options and things that can meet your goals as you go through the process of prenatal care.
Yeah, but just don't do nothing. How about that? Just don't do that. And make sure you share this video because this is some great information. And I love to get a chance to talk to our professionals because a lot of times we don't get a chance to just sit down and talk and find out what we should be doing. Now, what are some of the key things that prenatal providers check for during those prenatal visits?
Great question again. Really, we start with the basics and then go all the way to things that are specific to obstetric care or pregnancy care. So just like when you go to the doctor, you come in, we're checking for weight to make sure that you're getting enough nutrition to support your growing pregnancy. And then we also check blood pressures to make sure that you're not developing one of the conditions that can arise in pregnancy rather. And one of those would be preeclampsia or hypertension or high blood pressure of pregnancy. So we do check your blood pressures and we check your weight. And those are things that help us track that you're progressing along appropriately. Other things we will measure is how high your belly is getting for how far along you are in the pregnancy. We call that a fundal height. And that gives us an approximation of how well the baby is growing, or if there are some other signs that the size of your uterus might not match up with where we expect it to be in the pregnancy. We're also looking at the baby's heart rate. So as much as your vitals are important, the baby's vitals are just as important. So you will hear if you see online or you heard from friends that hearing the baby's heart rate at appointments, that's one of the vital signs that's critical for us as well. And then we continue your healthcare as a woman for other issues. If you're having any vaginal complaints or pelvic complaints, any breast concerns, skin concerns, these are all things that matter to us as you are the patient. And we want to continue to optimize your health and also address any concerns that come up that maybe you hadn't had a chance to address previously. And now that you're in the office, we can help you with those as well, whether they're pregnancy related or not. It gives us a chance to do that.
Dr. Smith, I just must say that your voice is so nurturing. Like, I believe everything you say. I would do everything that you told me to do. Now,
Thank you.
how can partners or family members support someone during their pregnancy? Because that's really important.
This is a big one because you don't want to be the source of stress. You want to be supportive to your loved one. Some ways you can do that are bringing them to appointments or being there at appointments, just to even be a listening ear. And if they don't remember something, you might say, wait, you asked that question 2 days ago. You should remember to ask that. Sometimes being in the room alone and being a source of peace is all you need to do. But other ways that you can be, other ways you can be supportive are finding out what your pregnant loved one needs. Do they need help moving, putting together furniture, washing clothes, going to the grocery store? These are all things that might seem normal for you and I when outside of pregnancy, but can be very exhausting and overwhelming to do in a short period of time. So truly anything from support emotionally all the way to acts of service can be really important. And helping people remember the things that they want to talk about in the visit. That's also something that is really critical to help your family member.
Especially at the end when you're like nesting and you just have to get everything done. It's like, are the bags packed? Are this is this done? Is the baby's nursery painted? Don't give us any mess, all right? Just do it. Just do what we
Just
ask you
do
to do,
it.
okay? Yes. Now, Courtney, what is centering pregnancy and how is it different from traditional prenatal care?
So centering pregnancy is a wonderful, different type of getting prenatal care, a little bit different, well, with the same elements that Dr. Smith described, but in a little different way. It's group prenatal care. And so what we have is one midwife and 6 or 8 pregnant people who are all doing about the same month with their partners, friends, family, kids, whoever they want to come to their visits can come. And we always have that one-on-one time. We always listen to baby's heartbeat. We always do the vitals that Dr. Smith was mentioning because those are elements of prenatal care. And we always have one-on-one time with the patient and the provider to talk about private things. But most of the group is spent in community. We have a beautiful centering room. We sit in a circle and we talk about different topics, all topics that are regularly covered during prenatal care, but we just have more time. People who do centering have 20 times more time with their healthcare provider. And so they're just able to get their questions answered, and they're able to ask questions, and just feel a little bit more prepared for pregnancy, for birth, for the postpartum transitions. Because, our visits one-on-one, we do our best to get all those questions answered, but it's a short visit by virtue of just the American healthcare system. And so centering visits allow us to have a little bit more time to be able to talk about what the patients want. We have topics that we're supposed to talk about: birth control, breastfeeding, labor. But, the other day I led a group and we were supposed to talk about breastfeeding and birth control. And we talked about those things, but people also wanted to talk about common discomforts of pregnancy. So we were able to pivot and spend a while talking about that back pain, talking about those issues that they were going through. And the other thing I would say that's really wonderful about centering is it's less provider-led. It's not me saying, this is birth control, you should choose this birth control or not choose this birth control. It's, what have you all heard about birth control? Has anybody been on birth control? Has anybody breastfed before? And really, my job and as a co-facilitator is to help guide the patients and say, well, actually, the data says, the research says that's not quite true. I think you must have been misinformed. Or just letting them talk and having them have that conversation so that it's really the patients that are leading the group and teaching the group.
That's such a big deal because I remember with my pregnancies, you're trying to find any information possible. Your partner, your husband, or whatever, they're probably tired of you asking questions just to them. So to open it up to other people that might be going through the same things and all of that to get more insight, I love that. I love it. Now, what are some of the benefits of centering pregnancy?
I mean, there are a plethora of benefits. I would say first and foremost, most patients come out of centering pregnancy, patients and whoever they have come to the group, more informed. So better understanding about the different tests that Dr. Smith mentioned that we do during pregnancy and the different assessments. And then also just more informed during labor. I want this. I don't want this. And again, that doesn't mean they can't change their mind in the midst of labor and feeling how uncomfortable contractions can be or whatnot. But they have more autonomy and more just feeling like they're more aware of things. Also, from a data point of view, we know that, or many studies show that centering pregnancy decreases preterm birth rate, which is so important. Preterm birth rate, decreases low birth weight, which is baby being too small. That people who do centering tend to breastfeed more consistently. They tend to be vaccinated for prenatal vaccinations more consistently. And again, they just tend to enjoy their prenatal care better and trust their provider better. And, particularly as a provider of color, building that trust is so important because although I have different lived experiences than my patients, spending 20 hours together allows them to know little things about me, know little things about my kids and my pregnancies and what I went through, and me be able to hear the other things, not just that their baby's moving and they're not having any bleeding, but, really a little bit of what's going on with my life and a little bit of what's going on with their lives.
Absolutely. I mean, do not discount any of these things. I wish those things would have been available when I went through my pregnancies, but all of those things are so, so important, those communities. Now, why is this model especially valuable in communities of color?
I mean, we unfortunately know that the maternal mortality rate and the infant mortality rate, or just pregnancy outcomes in general for people of color in the United States, is deplorable. And so this is something within Cleveland, within the greater United States, that we are working on trying to fight and improve. And as I said, centering helps decrease preterm birth rate, decrease low birth weight. Those are impactful things to our patients of color who have higher rates of those bad outcomes. So I would say that is important in general, building again that trust, patient to provider, but also we know that as white providers, we have bias that affects how we care for our patients of color. And that is something, so it's certainly not just on the patient to build more trust, but it's on the patient or the provider, to be able to really recognize that this patient is a wonderful human and I need to do the best job taking care of them, regardless of, what they look like or whatever. And then also it's just community. I mean, we talked about how there's so much going on in pregnancy and so many changes, and many patients have a support network, but unfortunately, many of our patients do not have a support network. And this is just a wonderful way. I mean, I can't tell you how many groups that I've led that at the end of the group, they have a group chat. I just finished a group and they were best friends by group 2. Everybody had everybody's cell phone number. Everybody went to everybody's baby shower. They all knew when the other was in labor and they all came to visit each other. And it's just a wonderful way of having a support network that is built into your prenatal care.
Yes, because if you think about it, there can be so many things that are passed along, things that your grandma or your cousin or somebody down the street told you. But I love the fact that it is provider led, so that when these questions come up, it's not just opinion based, like, oh, well, throw some baking soda on it, or I don't know, something of that nature. You can get some real answers to your questions. So I love what you guys are doing. And I want to thank you, Courtney, for joining us today, and Dr. Smith, and sharing such important information about prenatal care and the Centering Pregnancy program. If you or someone you love is expecting, don't wait. Schedule your prenatal visit today. Schedule it today. I want to remind everyone to prioritize your health by finding a doctor you trust. If you're interested in centering pregnancy, you can call 216-759-9459 to schedule an appointment today. To learn more about our Black Health 365 program, visit wzakcleveland.com/BH365. Thank you so much, ladies.
Thank you.
Thank you.
Have a great day.
All right, guys, share this video. It's your girl, Kenya Brown.